everyone, my name is Lan Zhang. Today I will be presenting the evaluation and sustainability plan for the Healthy Phoenix Living Obesity Prevention Program. This program focuses on reducing obesity rates among low-income adults in Phoenix by improving access to nutrition education, healthy food, and physical activity opportunities. I will walk through the program overview, evaluation design, logic model, sustainability strategies, and equity integration. The program focuses on adults and adolescents living in low-income neighborhoods in Phoenix, many of whom are Hispanic, Latino, or African American. This community have some of the highest obesity rates, especially among residents with a BMI of 30 or below and limited opportunities for physical activity. Geographically, Phoenix faces unique challenges. Extreme heat makes outdoor activity difficult. Several neighborhoods are classified as food deserts, and access to parks and recreation space is uneven. As a result, obesity rates continue to rise. These disparities are driven by structural barriers, not individual choice alone. Our program aims to expand access to healthy food, safe activity spaces, and cultural relevant education to improve long-term health for underserved populations. Our needs assessment uses data from the Maricopa County Public Health Department and CDC obesity surveillance. Key findings show high obesity prevalence, limited access to fresh produce, and a lack of structured activity programs. These findings support the need for a community center-based approach. We also need to community stakeholders, which helps ensure cultural relevance, trust, and realistic program design. The program is grounded in social cognitive theory, which emphasizes behavioral change through self-efficacy, observational learning, and environmental factors. By providing hands-on nutrition workshops, guide physical activity, and positive social support, the program strengthens individuals' confidence and motivation to adopt healthier behaviors. Community centers create an environment where healthy choices become more accessible and achievable. Here's the key SMART objective guiding our program. First, by June 2026, all 5 community centers will offer weekly nutrition and physical activity workshops. Second, by the same date, each center will enroll at least 25 adult participants. Third, by September 2026, we will conduct monthly feedback sessions to continuously improve program quality. For our main objective, by December 2026, at least 25% of participants will show improvement in their diet, physical activity levels, and BMI. For process indicators, we track the number of centers delivering weekly workshops, average attendance at each sit, and the number of monthly feedback sessions completed. For outcomes, we measure the percentage of participants who improve their diet and physical activity, pre and post BMI changes, and overall participants' retention. These are assessed through surveys, attendance logs, and BMI screenings. For this program, we are using a simple pre and post evaluation designed to look at changes in behavior and BMI. We collect data through surveys on diet and physical activity, BMI measurements at the beginning and the end of the program, and attendance log with feedback from. The sampling is a convenience sample. Adults who choose to participate at the 5 community centers. To keep the data valid, we will use the same BMI twice across all seats, standardized survey questions, and we include participant feedback to make sure our measures stay accurate and relevant. I split logic model to 3 parts. This is the first part. I cover our input and activities. Rely on public healthy staff, community healthy workers, and strong partnerships with community centers and clinics. It also uses simple material for nutrition lessons and physical activity, supported by logic fund. With these resources, we offer short nutrition workshops, create more access to healthy food, host community activity events, and reach people through trusted partners. This is the second part, output and outcomes. The program will track how many workshops it runs, how many adults join, and the community partners work with, along with new food access opportunities. In the short term, it helps people gain basic nutrition knowledge and feel more confident making healthy choices. In long term, it accepts they have better eating habits, more regular physical activity, and improve weight management behaviors. This is the final part of logic model. Long term, the program wants to help lower obesity rate among low-income adults in Phoenix and support healthier community overall. Assume participants stay engaged and partners stay involved, but outside factors like funds, the economy, and logical places can still affect how well the program works. Long-term sustainability comes from mixing different funding sources like grants, non-profits, and local sponsors. Showing that the program works helps keep that support going. Strong partnerships with community centers and clinics also build stability. Trained volunteers can stay in as peer ambassadors, and over time, local organizations can take on more ownership to keep the program running. Growth focuses on bringing this model to more neighborhoods and connect with clinic referrals so it becomes part of regular preventive care. Standardized toolkit help new sites start quickly. Challenges like unstable funding or dropping participation can be managed through more diverse funding, flexible scheduling, volunteer support, and better food access options. This program ties healthy equity into both the design and the delivery. At the structural level, it focuses on improving access to affordable, healthy food, creating safer places for physical activity and reducing transportation barriers. Community-wide stay central through resident input, local peer leaders, and culturally relevant materials. This goal is to increase access to healthy behaviors, close BMI, and chronic disease gaps, and support stronger community empowerment. This is my reference page. Thanks for watching and listening.